I just want to take a moment to thank everybody and all the participants and the parents and healthcare professionals who are with us this morning. I think this is an incredible forum for conversation and certainly for tips that everybody can take forward to their families. And I want to echo what Ed and Catherine has already mentioned. From my perspective, both treating patients in the pediatric emergency department and in my community office. COVID obviously is something that we have to be mindful of, but by far and away, kids are doing very well. It's a self-limited illness, and really a modicum of a moment of reassurance to parents and families. I think as well, there's a lot of unnecessary discussion, anxiety about vaccines and stuff. Some of that is even transmitted down unnecessarily to the kids themselves. As Ed has alluded to, vaccines are extremely beneficial. And I think we have to direct the questions and energies on the vaccine issue to items like mental health. I think an important aspect, and what I try to do when parents come to my office, tears with unbeknownst to them, a mental health issue that they were not expecting, is to reassure them that they are amongst what unfortunately now is a normal fold. As Ed has mentioned, as Catherine has mentioned, studies that have done by my colleagues in our emergency department and across Canada, there really is an explosion of COVID-related mental health issues. No one is left untouched. I'm no mental health expert, but I think the bottom line is, there's adversity, whoever you are, whatever social class you're in on a daily basis. And COVID, in essence, has limited our usual coping mechanisms. Our routines are off, what we do is off, the routines for our kids and families are just not there. There is resilience still available. And part of what we have to do, as Leanne has mentioned, is sort of to channel strategies to that available resilience to help parents and families. Again, parents have to know that unfortunately this is what the new normal is, and it's okay to come forward with your problems to your healthcare professional, and it's okay to talk and speak about it. Part of the pearls that I try to teach in practice, and these are pearls that I'm still learning as a parent. My wife and I are parents of three young adults, two young adults and an adolescent, and a lot of this learning, I think, and reinforcement comes from my wife, who probably is the more astute parent than I am. Is that as parents, what kids and families look to us is to set the goalposts and to set the boundaries and to enforce that structure. And I think it's so important, and even more so during COVID. As parents, we have our own stuff that we're dealing with, but I think that we have to take a moment and ensure that whatever the situation is and however the situation is different, to be able to be that goalpost and to set the boundaries for our kids and young adults, because they are looking to us for that guidance. And as parents, and we see this in the office all the time, anxiety will be transmitted to your kids and young adults. So it's really an effort to try to maintain structure, and I think, as Leanne mentioned, to evoke strategies to ensure that structure and to be innovative during this time. And I think, as Leanne already alluded to, one of the first things we can do in terms of a strategy is create a forum for our children and adolescents to know that it's okay to talk, it's okay to express their feelings. And parents often come to me in my office and sort of angry at their kids because they found out through back channels that their adolescents were lying or not owning up to the truth about their feelings. Parents have to understand that, you know, the developmental stage that adolescents are at is, you know, they're trying to figure out some sort of autonomy, and you know, they don't want to burden their parents. So I think that parents have to set the structure for non-judgmental conversation. You know, I often recommend, as I think Leanne alluded to, a trusted family member, a teacher in a school, or, you know, a parent themselves, a pediatrician, a healthcare provider, a social worker, a guidance counselor, where the young adult feels that he or she can go and express his or her feelings in a non-judgmental fashion. And, you know, just a brief anecdote, again, I have the privilege of caring for patients in the emergency department, in my community office, and more recently on our KixCare platform. And I had the opportunity to meet a young adolescent female and her mom, who called because she has been depressed and has been withdrawn for 3 or 4 months. And, you know, as Catherine has alluded to, as pediatricians, certainly we're emancipating skills that we haven't necessarily been taught in terms of being, you know, offering mental health advice. And really the best I could do for that adolescent was to be there on a bi-weekly basis to chat. We did talk about medication, and I finally brought her into my office for an in-person visit. And we talked about medication again, and her and her mom said that, you know, she's doing better. And it was really just the opportunity to talk and to have her feeling validated in my mind that made the difference. And certainly that was great learning for me. And I think that, you know, if we can, as a first order, somehow increase the capacity where kids and adolescents can talk, then we would really be doing a great service. And again, you know, as Ed and Catherine has alluded to, I think part of the going forward is, as a pediatric community, and as advocates for adolescent and child health, is to really figure out ways of enhancing capacity for mental health services. You know, people like Leanne, like Pam, like Erin are certainly in short supply. And I think we certainly have to be innovative in our strategies to provide access to more patients and families. So I look forward to the great conversation going forward.